Albinism is a condition wherein the human body does not produce enough of the pigment melanin. In some cases, there may be absolutely no melanin produced. The lack of melanin results in a discoloration of the skin, hair, and iris of the eye. Persons suffering from albinism have extremely light hair, pale skin, and no color in the iris. This allows the blood vessels at the back of the eye to be seen and make them appear red-eyed. The strange appearance of the person suffering from albinism often subjects them to social stigma. However, it is not a condition that can be transferred by contact, as it is caused by a genetic defect. It is not contagious, infectious, malignant, or cancerous. It does not affect the lifespan of the patient but can cause complications in their lifestyle. Causes of albinism. There are primarily two kinds of albinism: oculocutaneous albinism or OCA and ocular albinism or OA. Both are caused by different types of genetic mutation passed from the parent to the child. A person suffering from albinism is at risk of having a child who also suffers from albinism. With OCA, however, if each parent has one normal pigment gene carrier, 25% of the children will be clinically affected, but 50% of children may be carriers of the albinism gene, while 25% have a chance of being born with clinical albinism. Some types of OA generally affect male children. They inherit the defective gene from their mothers in what is termed as X-linked inheritance. These children will have problems with their eyesight, but the skin and hair color is usually not grossly affected. Thus, it may generally be seen as normal or somewhat lighter than that of others in the family. Female children usually have a much milder form of OA, as they have one normal X chromosome along with the mutated X chromosome. Hermansky-Pudlak syndrome is a very uncommon form of albinism. It is seen most often in Puerto Rico and may be caused by a genetic defect in any one of 8 different genes. The symptoms may be very similar to OCA, but in addition, the patient may have lung disease, bowel problems, and bleeding disorders. Patients tend to bruise easily and need to be careful with their movements.